Good morning and welcome to this RSPCH webinar on enhancing our wellbeing and resilience. Thank you for joining us. This morning's presentation will be presented by Dr. Bovjani, who is a consultant paediatrician at Medway Maritime Hospital and also the RSPCH Officer for Professional Development. Those of you that have dialed in through the webinar, you'll see a questions panel on your screen and you could submit questions at any time during the webinar and we'll take them after the end of the presentation. So I will hand over to Dr. Jani to start his presentation now.
Good afternoon to everybody who's joined this webinar at the college. I'm going to be talking about how we would enhance our well-being and resilience. This is a very important topic and probably of great importance to medical practitioners, as I will allude. The objectives of the workshop are to define work-life balance, and for the purposes of the rest of the talk, I will refer to it simply as life balance. We'll also look at what we mean by resilience, define well-being, understand stress, and hopefully also understand burnout, rust out, and I will highlight the importance of self-compassion and mindfulness. We will need to look at why all of these are particularly important for medical practitioners and how we are aware of our own personal stress triggers. Hopefully, we can also develop resilience and achieve our own life balance and well-being as a result of this process. The importance of understanding that medicine is a stressful profession. This is well accepted now across world literature. And a report in 2008 by the Department of Health looking at mental health and ill health in doctors highlights this particular issue. This was based on a sad occurrence where a medical practitioner with bipolar disease and also puerperal and postnatal psychosis not only killed her child but herself. This is a sad case of Daksha and Freya Empson. This report was published in 2008, and I think there's been a lot of discussion about how to help medical practitioners deal with illness in general, but also mental health. There are quite a lot of references I've highlighted at the bottom of this slide for anyone who wants to read a little bit more around this subject. We have professional responsibilities. Clearly, the GMC as a regulator is interested in making sure we're performing well with regards to the domains of the good medical practice, but also to ensure that we maintain our own health and we do not cause problems for patient safety. Trainees will have annual ARCP and trained staff will have annual appraisals. Both of these require a health declaration, and trainees require the enhanced Form R also to be completed. All of these are required for revalidation and license to practice and clearly relate to fitness to practice. There is quite a lot of evidence now that well-being may be linked to better patient safety and clinical outcomes, and for the practitioner, hopefully a fulfilling career. There are professional vulnerabilities. Let's go through these in a little bit more detail. You may or may not be aware of some of these. It's well accepted now that as a profession, we tend to be self-critical and often lack self-compassion. We tend to self-diagnose medical conditions and self-treat. Now, GMC is very clear about this now, that we should not be doing this and we should seek medical advice from general practitioners or from occupational health, or indeed confidential specialist services which are now available. This actually is important because we generally have poor access to healthcare because of the fact that we move from job to job, and also we feel that we have full medical knowledge and we do not require the input from general practitioner or occupational health. We're also a group that are reluctant to take time off from sickness or acknowledge sickness when present. We do have an increased vulnerability to mood disorder. The prevalence rates of depression are quite high, and the lifetime risk is twice that of the background population. Equally, suicide and addiction rates are also higher than the background population. Mental health issues and cognitive impairment may present with poor performance or difficult behaviors, and these may then get highlighted to trust authorities or to the GMC. We have the National Clinical Assessment Service and trainee support frameworks to support trainees and also trained staff. Clearly, there are also Royal College initiatives, particularly from the Royal Colleges of Psychiatry and Anaesthesia. Career transitions cause significant stress, and this is being increasingly recognised by deaneries and also Royal Colleges, and there is a need for more work in this area. The profession often has a problem with stigma and taboo around illness generally, disability, and this relates more specifically to mental health issues. And this is again an area where we do need to do more work, and simply by articulating this problem may go some way to achieving this. Medical practitioners also suffer significantly with perfectionism, and this can cause problems if over indulged, and there is also a reparation effect that's been described, where medical practitioners may have come into medicine and perform compulsively because they wish to reduce depression or anxiety as a result of medical illness that they may suffer with, or medical illness that family members may have suffered with. Public expectations for health delivery are extremely high at present and demand the perfect healer. We're supposed to be in a no blame culture within the NHS. However, the current perception is that we do have a degree of blame attached to mistakes or errors that take place. And the current case of Dr. Hadiza Bawagaba is particularly topical and has caused significant anxiety in the entire in the profession. Licensing and employing authorities wish to identify practitioners in difficulty, and this is appropriate, and it is significant that we do need to take responsibility as individual medical practitioners to ensure that we look after our own health, and in particular our own well-being. Revalidation inquiry into well-being and self-declaration of well-being is a step in the right direction, but this should be seen as a constructive requirement rather than the GMC checking on its members. There is a perceived impact of GMC license to practice, and therefore a tendency for practitioners to conceal or deny illness, and particularly mental health issues. Working environment is challenging at present, and the debate ensues as to whether the European Working Time Directive, modernising medical careers, or the availability of less than full-time training has improved matters or simply exacerbated matters. We will look at defining stress and stressors. So stress is the non-specific response of the body to any demand made upon it. Stressors are demands which contribute to stress by overwhelming our adaptive capacity. The balance is tilted away from feeling that we can cope. So within the NHS, this is simply a relatively short list of areas where people feel that they feel stress, or they feel that these factors represent stressors. Clearly, workload and lack of support, particularly as trainees, has been highlighted in GMC surveys. The working hours, shifts, and the daily commute has been a problem ever since shifts were introduced. The Royal College of Pediatrics, the Royal College of Physicians has produced guidance of this, and I've placed a reference to this at the end of the presentation. Problems with sleep and disturbed circadian rhythm may go some way to causing problems with well-being, and is now increasingly recognized. There may be external generated targets, ineffective leadership and management, or perceptions that there is ineffective leadership and management, excessive and punitive governance, Again, these are perceptions, but there's some evidence that trainees and practitioners who are trained feel that this is causing stress. Patient demands have increased, and we're increasingly seeing the aptly named Google Care, where patients expect levels of care based on internet searches. There are clearly funding issues. We have experienced also a lot of stress whenever we deal with death and significant incidents at work, particularly when they're being investigated. Bullying and undermining has also been highlighted in GMC surveys. We may experience difficulties with colleagues or working within teams. We may experience complaints, litigation, and of course, high-profile cases that are always in the media. There are always going to be performance drives within the NHS as a cyclical event, and there may be interpersonal and ethical conflicts experienced. In the last 2 years, we've also seen changes to contracts in terms of services, particularly for trainees. And all of these factors have been stressful for practitioners. I would like to highlight this particular graph, which I think is always useful to understand. On the y-axis, we have performance. On the x-axis, we have arousal stress. And this effectively, we're looking at good stress and, of course, bad stress. And the point being the maximum point of performance. And at that point, one would feel fatigue. And if one continues at that level, then effectively we may start a cycle of exhaustion, ill health, and breakdown. And this is referred to as the burnout cycle. We can improve matters by using mindfulness techniques as an example. There are other techniques also described, but mindfulness has been shown to improve performance without necessarily getting this burnout cycle. Practitioners who've experienced burnout often try to reduce their stress significantly and at that point accept lower levels of performance. However, they find this also stressful because they're used to a higher level of performance. And this is referred to as rust out. It's generally now accepted that it's best to practice in the green zone, which is before one feels fatigue and at a point where we're actually getting significant performance, but at a reduced level of stress. The NHS leadership model published in 2013 gives a very good definition of well-being within the context of leadership, and this is in the context of personal leadership. And it states that the most important element of leadership comes from a combination of emotional expressiveness, self-confidence, self-determination, and the freedom from internal conflict. Furthermore, the leadership framework in Dimension 9 talks about leading with care. And here we have an explicit description of ensuring one's own well-being, but also the well-being of others. At present, it would not be particularly inaccurate to use this slide or cartoon to describe what we're seeing in the NHS, where we have a lot of management and data collection. We have some taboo subjects, such as ill health in doctors, that are generally not discussed. And then we have naming and shaming of chief executives, and also now clinicians who've been involved in potential manslaughter, as was the case with Dr. Bauer-Garber. So I think it's pertinent that we should start to articulate and define well-being. And Erickson, Rogers, and Maslow have done a lot of work to try and look at this area, and they describe it as the ultimate goal of human endeavor. We will describe well-being as a dynamic process that gives us a sense of how our lives are going, allowing us to give a positive response to difficult circumstances, and greatly enables good outcomes. So this is understanding well-being in the context of things that are going well, but also things that are not going so well. What is resilience? Resilience is from the Latin resiliens, which is acting, the act of rebounding. And this has been defined variously as coping and bouncing back, bending rather than breaking, learning to endure and becoming tougher, persevering and adapting. Other people have also defined resilience as the ability to say yes to new opportunities and also to say no to situations that make you unhappy or where you feel there's a lack of well-being. Resilience seems to be very central and binds what we consider to be appropriate action in everyday life with confidence, social support, adaptability, and purposefulness. Tolstoy also describes in a letter that one can live wonderfully in this life if one knows how to love and work. And he alludes to the fact that well-being may actually not just be simply a question of personal well-being, that there is also the idea of social well-being, and then well-being that comes from effective work. We can define well-being by including terms such as emotional well-being, positive feelings, absence of negative feelings, satisfying life, vitality, resilience, self-esteem, trust and belonging, optimism, positive functioning, competence, autonomy, engagement, meaning and purpose, supportive relationships. But most importantly, it seems to map to a concept of self-compassion. I've included a reference to self-compassion inventory in the reference section that you may wish to complete, and it will give you a pretty good idea of how self-compassionate you are. There is some science to well-being, and this has been looked at and published as a project by the Foresight and Mental Capital and Wellbeing Project, which published their findings, and they alluded to 5 domains: connecting to others, and this means social connections; being active, this relates to eating appropriately, sleeping appropriately, and exercising appropriately. Taking notice is a reference to mindfulness, as one takes notice of situations around ourselves in a non-judgmental way. And keep learning. Doctors don't have a problem with this. We're constantly learning new techniques, and understanding medicine is an ongoing task. But I think this should be in the context of doing other things apart from work, i.e. hobbies and developing interests outside medicine. And then finally, giving. So giving to others may engender a sense of well-being, and this would be obviously in the context of caregiving within medicine, but also outside this. Life balance has 4 cornerstones, and I think one should always look at these in our own personal context. So different demands on time and energy, allocation of time and energy, applying values to your choices, and being brave in making choices. So in summary, balance is the key to life and well-being, and well-being is not a state, but a sense of balance, a sense of equilibrium. So I'm going to go through this matrix with you, and I would recommend that you do spend some time filling this out for yourself, so you're better able to understand what gives you balance in your life, and what actually takes it away, and what you do to get the balance back again. So we'll try and answer these questions in my own context as an example, and you may wish to apply this yourself. So let's look at the first question. How do I know when I have a sense of balance and well-being in my life? Well, I generally feel that I'm active. I want to do things. I sleep very well. I'm usually not irritable. I actually find social contact helpful and useful and enjoyable. And I'm engaged in hobbies and interests. And I'm also very productive at work, and I think that's important, and I get good outcomes with my patient care. With regards to question 2, how do I know when I'm losing this balance? So it's often the opposite of those things. So I might start to make errors at work. I might get irritable with my family or my colleagues. I would probably not sleep very well. I might eat excessively or not eat appropriately, and I probably don't feel like exercising, and I really am not interested in hobbies or anything outside medicine, and I may not even be interested in what I do at work. The third question is, what circumstances move me away from this balance and well-being? And for me, it would be finding myself in a hypercritical environment at work, where if something has gone poorly and there's been a poor outcome, then there seems to be a lot of discussion around fault finding or blaming somebody. And I think I always find that tends to move me away from the balance that I've achieved. There may be issues such as personal health, or family members who are not well, that would also affect my balance. And then finally, question number 4, what conditions bring me back to a sense of balance? So I tend to follow those 5 dimensions that I mentioned that enhance well-being. So I do like to sleep very effectively. So I keep a circadian rhythm. I generally go to sleep at the same time and wake up at the same time. I make sure I have small meals throughout the day, and I'm not having heavy meals, particularly in the evening. I do try and do brisk walking. I find joining a gym hasn't worked for me, but I do find brisk walking works. And I may do quite a lot of walks around the hospital or in hospital corridors in between clinics. And I find that sort of calms me down. I might do relaxation techniques, and I find social contact with family particularly helpful, or with friends. And my hobbies also help me to get me back to a sense of balance. So I would actively engage in painting or playing musical instruments because I know they help me. So that's an example of how I'm using this matrix. Now, I filled out my matrix and I keep it next to me near my computer at work, and I also keep it at home in near my bedroom. So whenever I feel like I'm losing balance, I just look at the matrix. It almost tells me what I should be doing, and then I have to actively engage with that. So there are strategies for action. So if you are interested to take this further and you're interested in improving your sense of well-being and resilience, then there are workshops you can attend. These are held nationally. Just keep your eyes open for workshops that may be available at deanery level, or even in your trust. It's always useful to understand the human mind, and I've got a slide that tries to explain that in a little bit of detail. Self-help is always useful, but it's important to realize that you may not always be able to help yourself, and sometimes help from others may be helpful. Start to develop self-compassion, start to develop mindfulness practice. There are miscellaneous techniques that I'm going to refer to in a minute, together with a reference book that I've personally found very helpful. You can seek help and support from others. None of us is an island, and I think we do need other people's support, and friendships and social contacts, particularly family, are extremely important. And you may be in a position where you start to help and support others, and that will help you with well-being also. So this is the work from Peter Gilbert, and it's quite interesting because he talks about brain biochemistry, and how this maps to how the mind is actually working, or should I say the brain is working to help well-being or to hinder it. So for instance, the drive system here, which is nucleus accumbens, which is a dopamine based system. Here we're looking at motivation, and we're looking at wanting, pursuing, achieving, progressing, focusing. This is, of course, something that most people who feel positive about their work will be using a lot. There's also the threat system, where you've got a lot of threats around you, or perceived threats, and then this will present with anxiety, anger, disgust. This is based around the amygdala and excessive release of adrenaline and cortisol. Now, if this is of course in terms of evolution was an important system. However, if it's constantly activated, as is currently the case with working in the NHS, with so much pressure on everybody, then this can mean that you've actually got 2 systems activated. The third system is actually a soothing system, and this is about contentment, safe, feeling safe, protected, cared for, and engendering a sense of trust. This comes from the prefrontal cortex and is mediated by opiates and oxytocin. And this is the system that we do need to activate actively. Forgive the phrase there. And often what's happening in medicine, we're activating these 2 systems and probably not giving enough support for this system here. This is work from Christine Neff, which is how to show self-compassion. This is a very simple summary slide, but I think it's useful, and it's about talking to yourself as if you were treating yourself in a kind, humane, forgiving, compassionate, and understanding way. And it's what's been shown is that people who are not self-compassionate often aren't able to do this, and surprisingly, in medicine, a lot of practitioners can't actually do this. We're showing compassion to others all day long, but we don't seem to be able to show compassion to ourselves. And this seems to map absolutely to well-being based on a lot of research. So there are three components to this. So the first one is mindfulness, which is simply acknowledging that something has happened and that you've had a moment where you've been unhappy or you feel that you've suffered. The second component is understanding common humanity, which is acknowledging that suffering is part of life and commonly felt by yourself and by others too. And that's not necessarily unique to yourself. And then finally, showing kindness, which is acknowledging that your desire to be free from suffering is perfectly valid compared to other people's desire to be free from suffering. Mindfulness, its origins are quite ancient. However, more recently, John Kabat-Zinn wrote quite a lot about this and set up a stress reduction clinic. And a lot has been said about mindfulness, but in a summary, it's literally paying attention to life events in a very particular way. And it's looking at the purpose, looking at things in the present moment only, and looking at things in a non-judgmental way. And it is the direct opposite of taking life for granted. This is a cartoon and slightly tongue-in-cheek, but I think it's trying to allude to what we mean by mindfulness, which is you simply notice what's in front of you rather than being very cluttered in your thinking, which is often quite common. Does mindfulness work? There's some evidence that it does, and a lot more research is now being done around its use in cancer therapy, certainly blood pressure reduction, depression, stress reduction, reduction in anxiety, people with sleep disorder, and interpersonal relationships. So it's been used quite widely, and it would be worth looking at this further if you're interested. There are other techniques, and the reference right to the bottom of the slides, I particularly found this book very helpful because it talks about stress very fully and outlines quite a lot of the principles and strategies for health and well-being in a general context. And there's information here that we can all benefit from. So it really talks about the fact that you need to change behaviors rather than your own personality. One needs to abandon the fear of rejection and failure. Need to change the mindset somewhat so that we are taking responsibility for all of our own actions. To improve self-esteem, self-compassion, self-affirmation, and assertiveness, and to develop a more spiritual approach to life, and developing coping strategies. There are particular techniques which are based around cognitive restructuring and reframing, CBT, journal writing, creative writing, poetry, problem solving. I particularly find reading poetry has been extremely useful and transformational for me. Human therapy, obviously we've talked about physical exercise, nutrition, sleep. Expressive art, color therapy, music and drama, singing therapy. These have all been studied in the context of illness. And I particularly find that when I paint, I have a great deal of well-being in relationship to that. Clearly going for a walk, gardening has been described, taking, and then dream therapy has also been highlighted. Now, I'm not going to go into all of these techniques, but you may wish to read the reference if you want more information. There are particular relaxation techniques and diaphragmatic breathing and awareness, and I've put a reference on the reference slide relating to this specifically as to how you do that, but there are others that you can look at. Hobbies and crafts is the easy way to do this, and I find this helps me. Even taking a bath compared to a shower has been shown to improve well-being. So we have a choice. We can continue with the paradigm that medicine has had for quite some time, which is just accept stress. It's an occupational hazard and don't complain about it. Or you can be over here and find that you're overburdening yourself with stress and actions and other people's demands. And yes, we could be the donkey in the air. Or aim for the elephant, which is we have a burden, we are doing important work, but it can be done in a balanced way. And I allude to Rumi's poem from the 13th century, which simply stated that yesterday I was very clever and wished to change everybody and everything. Today I am wise and only wish to change myself. And I think this particular poem has helped me to focus my priorities in ensuring my own well-being. These are the references and resources that you may want to look at. We have reference to the Practitioner Help Program, mindfulness online training, the online stress test. There are self-compassion tools that one can use. This one is the breathing meditation technique described by practitioners in Oxford. We have various books, and I will highlight Ballett and Campling's Intelligent Kindness, Reforming the Culture of Healthcare. This refers to organizational health and individual health. We have Kirsten Neff's book on self-compassion and references to the inventory that the Royal College of Physicians guidance to shift work in general, but in particular the night shifts and recovery from them. I will particularly point out Caroline Elton's book that was published this month, titled Also Human, The Inner Lives of Doctors, which is particularly helpful. BBC News item on perfectionism, which is extremely useful, and a book published in 2017 right at the bottom there, which is looking at the fact that organizations also need to look at enhancing well-being rather than simply putting the onus on individuals. These are some references for help and advice. So if you wish to access any of these services, then these are references. And I'm told that the webinar will be available for some time. And certainly this is an extremely useful resource for anyone who wishes to seek help if you've got any specific well-being or mental health issues that you wish to address in a confidential manner. So at this point I will stop and I'd be happy to take any questions, thoughts and ideas, as this is a subject that we're all learning from each other as how best to achieve well-being. Thank you.
Thank you, Dr. Jani, for a really thought-provoking and detailed presentation. There is now the opportunity to ask questions. So those of you that have joined us online, if you'd like to use your questions module to type in a question, we'll be happy to take that. In the meantime, because this is focused particularly on trainees returning from a career break, if a trainee returning to a trust didn't find that they were in a particularly supportive environment, we're feeling quite unsure about where to go for help and support, what particular resources, what particular suggestions would you make to support a returning trainee in terms of where to go to access that support?
Thank you, Sarah, for that question. I think it's an important question. Trainees returning back to work are supported through the deanery structures. They're now referred to it as health education providers. You also have, you should have an educational supervisor that you can go and talk to if you feel that you've got any concerns. The Director of Medical Education and clinical tutors within trusts are another resource for you to access. There are also There will also be training program directors and heads of school that you can access if you have any specific questions that relate to your placement, or if you feel there are some issues with regards to the commute that you have, based on where you live and where you will be placed. So I think there's quite a lot of resource, certainly if you're a trainee, because the deanery structure actually will protect you with regards to your questions.
Thank you, Dr. Jani. And in relation to specific resources, specific training programs around mindfulness, are you aware of specific ones for doctors, for trainees within deaneries, within trusts?
I think that's a very good question. I think there are local initiatives available. So I do know that deaneries are setting up wellbeing workshops and mindfulness workshops. There's also initiatives locally in trusts. Certainly in my trust, there are wellbeing days, and there are workshops around mindfulness. You may wish to look at one of the resources. We're all very busy, and doing something online may be more appropriate. So you might want to look at resources that are available online, and I've got a reference there for you. There are books written on the subject. It's actually a developing subject, and I think sometimes we're in a rush to appreciate mindfulness, but it does require quite a lot of discipline, understanding, and then application. So I think just checking out your local setups may be the first starting point I would suggest.
Thank you. We have a question that's been submitted by Caroline. She asks, I wonder if you can suggest how we can, as doctors, think about working more flexibly to enhance our well-being and improve our work-life balance. For example, not just looking at less than full time, but considering whether we could look at the structure of the working day, such as working 10 till 6 to allow for school drop-off, or working, say, 3 days a week over 4 days, to allow for this balance with the need to attend clinics, wards. Do you have any personal experience or examples, for example, of how we might look at this?
Yeah, that's a very interesting question, because I think we've become slaves to the clock, and I think the shifts system that we have means you have a set handover time, and you have to start at a certain time, the clinic start at a certain time, and so on. So I think that this is an example of where we actually need organizations to actually change the way we work, and I think the patients are demanding clinics in the evenings and weekends and so on, and I think it's also about as a profession, we need to start having that conversation with our employers, to say, right, can we work more flexibly? Now, I think for trainees, this is quite difficult, because you've pretty much locked into how shifts work in hospitals. But as trained staff, certainly one can negotiate one's job plan, so that you have a half day within the week, and it may be that you transfer some of that time to starting slightly earlier in the morning and finishing slightly earlier in the afternoon. And certainly I know of colleagues who are working less than full time that have done that. I actually work full time, and I've recently negotiated Friday afternoon relatively free from clinical responsibility. And as a result, I now start a little bit earlier in the morning, may finish a little bit later in the evening. So it's about negotiating that.
So thank you for that, Dr. Jani. I think we're at the end of the question and answer session now. So first of all, thank you again to Dr. Jani for a very interesting and informative presentation. For those of you who have colleagues who weren't able to listen into the webinar today, we have recorded it, so it'll be available for the next 12 months on our Compass Learning Management System. We also intend to produce further webinars on the resilience and wellbeing topic over the coming months, so do keep an eye on the RCPCH courses listing section or on the Compass Learning Management System for those dates and recordings. As we've reached the end, it just remains for me to thank you as delegates for joining us today. I hope you found it useful, and we look forward to welcoming you again to future RCPCH webinars. Thank you.